Hello, it's Dr. Addy again. Nice to be here. I was here 5 minutes ago. Essentially, we're going to continue on about the topic of obesity. Now, why are we doing this? Because we want to reduce the risk associated, want to reduce the medical problems which we discussed, and obviously want to consequently increase life expectancy, as we discussed earlier. Now, what do we do when we've made that diagnosis? Most people will say, look at your diet. And essentially the diet, you can eat well as long as you reduce your sugar, carbohydrate, which is broken down into sugar, and fat intake. So if you decide, okay, I'm going to go for a high protein intake, you're doing well. So high protein, you can have carbohydrates, but limit your carbohydrates and have a lot more high protein. So chicken, turkey, fish, meat, with salads on the side, or with a bit of rice on the side, a bit of potatoes on the side, and just adjust your diet accordingly. That reduces your calorie intake. Now, having said that, you might have to do a bit more exercise or a bit more activity. In fact, this isn't a might. This is you should. You should make it a habit, because apart from increasing your physical health or improving your physical health, it improves your mental health significantly. It improves your social being as well. You will meet so many people in cycles where you're both doing the right, we're all doing the right things health-wise. So it has many positive factors in that sense. So again, it boils down to energy input and expenditure. Now, we were talking about the medical causes of it, and that includes hypothyroidism. So anywhere where your metabolic rate is reduced will increase weight, and that happens with hypothyroidism. If that's the case, it's very important that we correct it. It's not their fault. We want to tell them what to do once we've managed to bring the metabolic rate up to normal. That's so easy to do. Just check the TSH, which is a simple blood test, and just make sure you brought it back to normal and the metabolic rate improves significantly. There are also some medications, so the things like steroids, things like sulfonylureas, which are diabetic medications, antipsychotics, which we use for mental problems, even antidepressants. So there are some tablets that actually can cause it as well. I'll be back in a minute to discuss more.